Kearns, I just wanted to check your audio really quick before we go ahead and get started. So if you can just say a quick hello, that would be wonderful.
Sure, great. Can you hear me okay?
Yep, you are good to go. Fabulous. I think we can get started then.
Okay, perfect.
Wonderful. Okay, welcome everyone to today's webinar, Sugar and Oral Health Messaging, Implications for PSE Change. Very excited to have you all with us today. My name is Wagata Semere. I'm an assistant professor of medicine and primary care physician at UCSF, Zuckerberg San Francisco General Hospital, and I'm also the director of the Champion Provider Fellowship. So we'd like to quickly have all of you make sure your audio is working. If you're experiencing any technical difficulties, just reach out on the chat and Alana can help you out. Just a reminder that everyone will be muted for the duration of the presentation, but we still encourage you to please use the chat function and submit your questions and answers there. Or submit your questions there, and we'll continue to monitor that throughout the webinar, and we'll have a dedicated portion of time for Q&A at the end of Dr. Kearns' presentation. Also, we do plan to distribute and post the recording of this webinar on our website. A few reminders, programmatic reminders. The activity update, your final activity update for cohort 3 is due Monday, May 10th. We sent out another Qualtrics reminder recently, I believe, and there's still time to fill that out. We'd love to capture more of your activities as we say goodbye to you when you graduate from the program. So please remember to complete those for us. And some upcoming events to keep in mind. Next week, we have our work in progress call, our Champion Provider Fellows. These are a great opportunity to informally engage and talk about the work that you're doing, network with other fellows. You don't need to bring a PowerPoint presentation, though happy to review that if you would like us to, but really it's just a setting for us to talk about challenges you're experiencing and also celebrate some of the successes and learn from one another. So we invite you all to attend at whatever stage you are in the fellowship. Alumni, please join as well, feel free to. And that's again next Thursday, 12:15 to 1:15 p.m. We also have an upcoming quarterly LHD call on the 20th, so please remember LHDs to check in for that, and that's just for our LHDs. And another plug for our op-ed project. We will be hosting this on Thursday, June 10th. It's limited to 30 people, so please sign up if you have not already. I know many people have expressed interest, but have not officially signed up, and we need you to do that to guarantee your spot. This should be an exciting experience. We ask that you commit to the entire time, that 8-hour window, to really get the most out of it. And remember that you'll have access to consultants for a month after this seminar to help you with any pieces that you have in progress, and they have a really high success rate in terms of publishing pieces, and we've been really excited to have the opportunity to collaborate and bring the op-ed project to the Champion Provider Fellows. Great. So today's presenter is Dr. Kristen Kearns, and I'm actually going to hand it over soon to Dr. Shikalpi, who is one of our Champion Provider Fellows and is recently serving in a role as one of our mentors for the Champion Provider Fellowship, a new program that we started this year. Dr. Pendekar is a director currently of the Oral Public Health Program in Mateo Health, and she's been a huge proponent of PSE interventions to reduce sugar-sweetened beverage consumption. So we invited her to moderate today's discussion with Dr. Kearns, and I will allow Dr. Pendekar to formally introduce Dr. Kearns, but I will just say thank you so much, Dr. Kearns, for being with us today. We're really looking forward to your presentation and happy that you took the time to spend with the Champion Provider Fellows. All right, I'll turn it over to you, Shikalpi.
Thank you, Bagata. I am pleased to introduce today's presenter, Dr. Kristen Kearns. Dr. Kearns is an assistant professor in the Department of Preventive and Restorative Dental Sciences and the Philip R. Lee Institute for Health Policy Studies at the University of California, San Francisco. She has become one of the first academics to rigorously study the influence of the sugar industry on health. Dr. Kearns has helped identify more than 600,000 pages of food industry-related documents now available online to researchers and the public as part of UCSF's Food Industry Documents Archive Library project. If you haven't had an opportunity to check out that resource, I would strongly encourage you check it out. We will put a link in the chat soon. Today's learning objectives are understanding the common problem definition claims related to sugar and dental caries, contrast public health and industry problem definition claims, understand facilitators and barriers to increasing dentist engagement in policy action on sugar. Following Dr. Kearns' presentation, we will allow time for discussion and Q&A. Welcome, Dr. Kearns. You're muted, Dr. Kearns.
Here we go.
Yeah.
Can you hear me?
Yes, we can.
And can you see my slides? Just want to double check.
Yes, we can.
Wonderful. Okay, thank you so much for having me. It's wonderful to be here with you and have the chance to share some of my research and also hear some of your feedback and comments. So I am going to talk with you today about sugar and oral health messaging and implications for PSE change. And just to give you a sense for the type of research that I do. So I've been primarily studying the sugar industry for the last 10 years. This is a screenshot from a website for the Americans for Food and Beverage Choice. This is an industry front group that got its start around 2008, 2009 to basically oppose any new soda tax, any new policy action on sugar anywhere in the country, wherever it was going to pop up. It's primarily spearheaded by the American Beverage Association, but as you can see, it has 8 different industry members that all work together. And I've spent most of my time studying the Sugar Association. So this is a trade group based in Washington, D.C. that represents the cane and beet sugar industry, mainly on health issues. And they all work together. And the sugar industry is a particular interest to me because sugar is their only product. So they care very much about policy and health messages related to sugar, and they communicate their research and messages across these different industry groups. So as I said, I've been studying the sugar industry. So one of the things that I've done as part of my research is uncover confidential sugar industry documents. And I found these actually in public libraries, believe it or not. There's a surprising amount of material out there, and we've turned this into our Food Industry Documents Archive, which we launched at UCSF back in November of 2018. So we now have over 600,000 pages of sugar industry related documents that are available to anyone online to be searched for research purposes. And this is an example of one that I think really illustrates the sugar industry's approach to oral health and dental caries in particular. So this is a transcript of a speech that the president of the Sugar Association gave back in 1975. He's actually talking to an international audience about what's going on in the US. And he's saying, of the attacks on sugar, the dental caries area constitutes our greatest worldwide vulnerability. Caries do not necessarily kill, but they are common to everyone, and their cost to all walks of society is of major concern. I would venture to say that without sugar's implication in dental caries, our detractors would not have a popular case to peddle. So tooth decay has been a major issue of concern for the sugar industry, and they've set out to influence debates about solutions to dental caries for a very long time. To give you a sense for how long it's been, this is actually a clip from the San Francisco Chronicle talking about banning sugary beverages in schools, and the rationale actually is dental health. So just in your mind, think about what date you think this clip is from. And it may surprise you or not to learn that this is actually from 1949. So we have been debating, trying to get sugary drinks out of schools for tooth decay reasons for a very, very long time. This actually didn't come true until 2012. So I'm going to share two papers with you today. This is the first one. This is a paper that I wrote with Richard Watt, who's at University College London. And in this paper, we argued that dental caries prevention must be understood not just as a health issue, but as a contested political issue influenced by powerful vested interests. And so dental caries is a social problem, and social problems become political when they can be potentially addressed by public policies, and they're characterized by conflict. And conflicts arise over who or what is responsible and what resolution should be attempted. So we, in this paper, applied a problem definition framework developed by Rochford and Cobb, where they defined 7 distinct categories of claims related to public policy. And I'm going to go through each of these throughout the presentation here. And the other thing they describe is the contested environment. So this is a boxing ring. We've got contestants on either side. The expanders are going to represent the public health side, who are trying to expand solutions to dental caries to include policy action on sugar, like soda taxes. And the containers represent the industry, who are trying to limit solutions to dental caries. They don't want solutions to include policy action on sugar. And we looked at the venue here, it's the World Health Organization. So the WHO has evaluated the relationship between caries and tooth decay going back 40 years. So that's the material that we looked at. So our expanders mainly were led by Aubrey Shyam, who just passed away a few years ago, and he's a maverick in dental public health. He was the chair of dental public health at University College London, and most of his work has really driven the evidence base supporting the link between sugar and caries, and he served on multiple expert committees at the WHO. Versus the containers, which are the World Sugar Research Organization, which is the international arm of the Sugar Association, and other industry front groups like the International Life Sciences Institute, Mars, Coca-Cola, and other international sugar companies. And so back in the boxing ring, now we've got the championship banners hanging from the rafters. And so the links between sugar and oral health have been examined at least 7 times over the last 40 years. And if the banner is in blue, that means the industry won. So back in 1979, the report discussed that sugars can cause tooth decay, but there was no concrete recommendation for policy action or to make any limits on sugar. In 1990, the public health side won. So there was a recommendation given to limit free sugars to less than 10% of total calories in a day. The next time the committee met, the industry won. And in this case, the BBC uncovered that the sugar industry had donated $60,000 to this WHO committee, and that experts felt afraid to say anything negative about sugar. 2003, the 10% limit was again put forward by the public health side successfully. But then in 2004, due to influence by the US sugar industry, who threatened to pull funding from the WHO, that 10% limit was removed. And then finally in 2014, this expert committee endorsed once again the 10% limit on free sugars, and it became official WHO recommendation in 2015. So finally, the public health side got a concrete recommendation for free sugars consumption after 40 years. So what I want to do is go through each of those 7 problem definition claim categories and demonstrate to you the messaging put forth by the expanders compared to the containers. So when we're talking about incidence or prevalence, how many people are affected by caries, the containers say that there have been enormous improvements in dental caries rates. They point to studies of decreasing prevalence in 12-year-olds in Western European countries, where they say a high proportion of children having a dentition free from caries exists, and they tie that to the amount of sugar available, showing that there's no relationship to caries prevalence in 12-year-olds, although it's important to note that most of those studies are funded by the industry. And the expanders argue that the conquest of caries has been greatly exaggerated. While they acknowledge that improvements have occurred, they argue that problems still persist, that caries is not just a disease of childhood, that we have to look at it from a life course perspective, and that new caries rates occurs at a relatively constant rate across the lifespan, meaning that prevention measures are necessary at all stages. Category 2, causality claims, what causes dental caries? Well, the containers argue that caries is a multifactorial infectious disease. This allows them to point to other factors being responsible for caries, such as susceptible tooth surfaces, intrinsic properties of the foodstuffs, oral hygiene practices, fluoride availability, genetic factors, salivary flow, for example. Whereas the expanders argue that caries is a diet-mediated, non-communicable chronic disease. They point to free sugars as the necessary cause of caries, and they argue that the multifactorial framing muddies our understanding and misdirects policy away from national sugar restrictions and other policy action on sugar. Looking at category 3, severity, what's the impact on individuals? Is caries getting worse? Here, the industry side is a bit silent. The expanders point to the fact that untreated caries in permanent teeth is the most prevalent condition globally. They point to numbers related to disability adjusted life years, as well as evidence that caries causes pain, anxiety, functional limitation, and social handicap through tooth loss. Category 4, tying it to a crisis. What's the urgency of dental caries? And in this case, both sides tie their arguments to the idea of a cost crisis. But here, the expanders cite numbers that the cost of dental care consumes 5 to 10% of healthcare budgets in high-income countries, and that this cost would exceed the entire healthcare budget for children in most lower-income countries. Whereas the containers also talk in language of cost, and this is a direct quote. What they say is, given that national governments worldwide are stretched to meet the healthcare needs of their population, it seems important to provide guidance in which there is considerable confidence to avoid wasting valuable resources on implementing actions that will not result in effective outcomes. Moving on to category 5, values, linking arguments to a strong emotional attachment. Here, the containers make personal responsibility type of arguments. So they emphasize individualism, meaning that solutions to caries should focus on personal and behavioral factors influencing the development of caries. But they also argue that singling out free sugars from other potentially tooth decay causing carbohydrates is discriminatory, whereas the expanders frame their arguments in terms of quality of life ideas, as well as the right to affordable health care. Category 6, characteristics of the problem population. The industry side argues that caries is decreasing and that it is limited to a small portion of the population. Therefore, reducing sugar's intakes for the whole population would only benefit a minority with high caries prevalence, whereas the expanders argue that most caries occurs in the majority and that caries-free dentition is not a good predictor of zero caries incidence thereafter. And then category 7, solutions. So what are the claims related to policy action on sugar? Here, the containers argue that policy action is expensive and ineffective. In fact, they say it would be damaging to the public, that sugar would likely be replaced with unhealthy fats. They argue that efforts to prevent dental caries should focus on achieving adequate oral hygiene practices with fluoride toothpaste, as this is proven to provide a much greater reduction in caries experience. And they argue that dietary advice should be focused on limiting the frequency of exposure to sugars, not the overall amount. Whereas expanders argue that policy action on sugar is necessary, effective, and would provide cost savings, that dental caries will not be resolved without drastic national reduction in sugar intake. Sorry, somebody's coming in with a... There we go. Okay. They argue that caries is still progressing in populations exposed to fluoride, that there's no known adverse effects of reducing sugar consumption, and that implementing sugar restrictions are likely to be associated with long-term cost savings in healthcare in countries. So from this paper, our overall conclusions were that the sugar industry has definitely sought to contain the dental caries issue over the last 40 years. They've tried to delay and avoid policy action on sugar. They've done this by debating statistics, sponsoring conflicting studies, influencing committees, and tying their position to crucial societal values. And then just to provide you a couple of US-based examples, this is an older example, but illustrative. This is from 2003. This is the American Academy of Pediatric Dentistry. And here, this is a press release announcing a 6 to 7 figure range donation from the Coca-Cola Foundation. And within that same press release, the president of the AAPD is saying that the scientific evidence is certainly not clear on the exact role that soft drinks play in terms of children's oral disease. So this was an example of sugar industry funding going to a dental professional organization and them being disseminating the industry message related to sugar and oral health. They've since changed their tune on this, but it is an example that it can happen. And then a more recent example here in San Francisco with the efforts to put a warning label on billboards related to sugary beverages. And the city of San Francisco proposed putting this warning label: drinking beverages with added sugars contributes to obesity, diabetes, and tooth decay. This has been opposed through litigation by the American Beverage Association. There's been multiple rounds of litigation. And in this case, the American Beverage Association cited the American Dental Association to support their lawsuit. So here, the judge is recognizing that the American Dental Association has similar to industry, cautioned against the growing popularity of singling out sugar-sweetened beverages because the evidence is not yet sufficient to single out any one food or beverage product as a key driver of dental caries. So this is an example, again, of a dental organization adopting and supporting the industry message to the detriment of public health action and policy action on sugar. Now, I should point out that the California Dental Association is extremely proactive and pushing policy action on sugar, and they are right there in the fight on soda taxes. but they are very progressive when it comes to dental professional organizations, and the American Dental Association has been more conservative on this topic, and they're not yet fully behind policy action on sugar. So that's paper number 1, looking at those oral health messages, expanders versus containers. And then the second paper I wanted to share with you, this actually just came out last month, just a couple of weeks ago. I had the opportunity to work with some colleagues here at UCSF, so Janelle Urata and Ben Chaffee. They were doing a survey of California dentists related to their tobacco cessation practices. And Ben asked me if I wanted to put on a few questions about sugar and policy action on sugar and media engagement. So I jumped at that chance and was able to add on a few questions to his survey. And so we were inspired by this article, which came out in 2015 from the Berkeley Media Studies Group. And they looked at the media coverage of the sugary beverage tax efforts in 2014 in both Berkeley and San Francisco. And they recognized that health arguments were often made to support these soda tax efforts. And they found that diabetes and obesity was mentioned in these health arguments something like 19 times more than oral health arguments. It was extremely rare to find an oral health argument in media to support soda tax policies, and oral health experts were almost never cited in the news coverage. And so they made a recommendation to the oral health community saying that we have this potential to really get our voice out there to support these soda taxes in the media. And then, of course, I was also motivated by my work looking at the sugar industry and wondering whether dentists have adopted some of the sugar industry's claims related to policy action on sugar. So this gave us the opportunity to ask some questions of California dentists, their attitudes on sugar, sugar policy, their engagement and media advocacy, as well as to ask them about whether they thought it's realistic for patients to reduce their sugar intake. This is a message that the industry pushes, that it's not realistic that people will reduce their sugar intake. And we also asked about whether dentists thought that soda taxes would be effective for dental caries prevention. The industry also pushes the argument that soda taxes are not effective for dental caries prevention. So we wanted to see whether this was reflected in California dentists' attitudes. So just briefly on our methods, this was a web-based cross-sectional survey that was conducted in the fall of 2018, got IRB approval. The sample was of 7,752 California Dental Association members out of their 26,000 membership directory. It's a quick 15-minute survey with reminders at 3, 7, 16 days. People were offered an incentive of a $10 gift card. And our target sample size was 700 based on calculations for the tobacco survey, which this was primarily a tobacco survey. So our outcome measures were related to social media. So we wanted to know of California dentists, how often have you posted to social media, made a blog post, written a website about sugar guidelines, or sugar restriction policies for dental caries prevention specifically. We asked the same question related to traditional media like newspapers. And then we also asked dentists how confident they were in their ability to talk to traditional or social media outlets related to sugar restriction policies, as well as how willing they would be to communicate publicly about policy action on sugar. And then our predictor variables, looking at what might influence those outcomes. We asked questions about overall health. So how harmful do you think added sugars are in food and drinks to overall health? And then specifically related to caries prevention, how effective do you think reducing sugar consumption is for reducing dental caries risk? And then we also threw in those questions related to those container claims, the industry claims. How effective do you think sugary beverage taxes are in reducing dental caries rates? How realistic for patients to reduce their sugar consumption? And then finally, we asked some questions related to professional responsibility and professional roles. So how much do California dentists agree that it's your professional responsibility to discuss topics like sugars and sugary drinks with patients? And then do you have available support from professional organizations to talk publicly about sugar restriction policies? So quickly about our analysis, we had 752 respondents, 624 answered all of the items related to sugar, calculated descriptive statistics for participant practice characteristics and their attitudes. We calculated a media engagement score. So we combined their answers on social media, traditional media, and their confidence and willingness to engage. And then we did an exploratory analysis of various attitudes that influenced this media engagement score. So some of our results here, just looking at the characteristics of the dentist sample. So the gender, race, and ethnicity percentages pretty much reflected national statistics. Years in practice, most were over 6 years, evenly split between 6 to 20 years and greater than 20 years in practice. Most respondents were in private practice. Most respondents did not accept Medicaid in their practice, and most were in urban settings. Looking at their behaviors related to media engagement. So how often do dentists post to social media or talk to traditional media about sugar and sugar policies for dental caries prevention specifically? 12% multiple times per year on social media, 5.8% on traditional media. The vast majority either never having engaged in media advocacy or having done it once or twice in their lifetime. So lots of room for improvement here. Confidence was a little bit higher than actual reported media engagement, as was willingness to participate. And then looking at dentists' attitudes towards sugar and overall health, most agreed that sugar is harmful to overall health, either extremely harmful or very harmful. Most agreed that reducing sugar consumption to reduce caries risk is effective. That's just reducing sugar consumption. Most agreed that it's their professional responsibility to discuss caries risk factors with their patients and to discuss sugars and sugary drinks with their patients. But when we look at those industry claims, is it realistic for patients to reduce their sugar consumption? Only 16% agreed that that was extremely likely. Only 12% agreed that it was effective that sugary beverage taxes reduce dental caries rates. So the majority felt it was not realistic or not effective for dental caries to implement sugary beverage taxes. And one last piece was available support from dental professional organizations. About 20% felt supported by dental professional organizations to engage in media advocacy. So now this is looking at that media engagement score, and we wanted to look at the associations between some of the attitudes and how that affected how engaged dentists are or reported that they are in media advocacy. So some of the key numbers here. So dentists who felt strongly that it's not realistic for patients to reduce their sugar consumption were significantly less likely to engage in media. So this was a scale between 0 and 7. So this is one of our lowest scores here. Dentist attitudes about whether it's effective, whether sugary beverage taxes are effective in reducing caries rates also influenced significantly their media engagement scores. So those dentists who believe It's very effective to reduce caries rates with a sugary beverage tax. We're the most engaged in media advocacy versus not believing it's effective. We're the least engaged. And here, another important factor was support from dental professional organizations to talk to the media. So again, this media engagement gradient was significant. So if dentists definitely felt supported by dental professional organizations to talk to the media, they were much more likely to engage. So some of our conclusions from this survey. One thing is we only looked at a very limited number of dentist characteristics, and we thought it's possible that political beliefs could have some impact on attitudes towards policy action. We also posited that perhaps a lack of training in social determinants of health might influence whether or not dentists are engaged in media advocacy around policy action on sugar. We reflected a bit on those container claims and, asking the question, have sugary food and beverage industry public relation campaigns, have those messages been adopted within the profession? The industry has been pushing those messages for at least 40 years. Do we need to identify strategies to counter those messages within our own profession? And then looking at professional support. So we think dental professional organizations can build on dentists' strong beliefs that it is their professional responsibility to discuss sugars and sugary beverages with their patients by collating and disseminating evidence about the effectiveness of sugar restriction policies to reduce dental caries, and by providing counter arguments to counter beverage industry challenges. And again, the California Dental Association is doing a lot of this. But there's also a need, I think, to look at disagreement within the dental profession. So what happens when you have the California Dental Association saying one thing and the American Dental Association saying another thing? That's not going to bode well for coherence within the dental profession. So with that, I think I hit my 35-minute mark, and I will pause and turn it back over and look forward to your questions, comments, and feedback.
Thank you, Dr. Kearns. So we will now start the Q&A session of the webinar. We will have time for a few questions. And if there are any questions that we were unable to address, then we will follow up with those questions offline. So I'm going to start with the first question that's posted here in the Q&A, in the chat box. And that's alluding to the hereditary question. If both parents have poor dental hygiene, if one sibling has dental caries at a young age, while the other siblings have no dental caries, they all eat the same diet prepared at home, some possible causes.
Okay, so you're speaking to the causality of dental caries, and this sounds like questioning whether diet is as important as we think it is. Is that sound about right? Are people able to talk, or is it just me?
I think Alana can unmute.
Yeah, we can unmute the person.
Okay.
If you'd like to
Yeah, it'd be nice to interact, if possible. I don't have a great explanation for you. I don't think that's, that one example is enough to counter the argument for reducing sugar consumption overall. It might, speak to different populations of oral bacteria, and I think one kid could be sneaking candy and not, telling the parents, just there are all kinds of different things that could be going on. But I don't think it's enough to reverse the need to take policy action on sugar. I'm not sure that, and I do wonder whether that answers the question.
Yes, the person wrote in the chat that that's it, but they're unable to unmute themselves. So
oh, got it.
We'll have to leave it right there.
Yeah. Okay, great.
Yeah.
Thank you. Here's another question. What would be one of the first steps that champion provider fellows could do to advance the dental community in engaging in issues related to sugars or sugar-sweetened beverages?
That's a great question. I don't know how much the California Dental Association is engaged in this program, and I think maybe Jay Kumar is engaged somewhat in this program, the state oral health director. But to me, I think the first step is coming up with a common voice, a common messaging strategy that needs to happen with Jay, with the CDA, so that everybody is saying the same thing. Whether that's through, a common fact sheet, whether that's through some educational events with all parties involved. I think that common voice is really key. And then making sure that champion providers have what they need to feel confident in advancing some of these arguments.
Thank you. And I think that's what's been going on. And that's why you see the California Dental Association sort of behind this issue of trying to reduce sugar-sweetened beverages and understanding, the reasons why. And Dr. Kumar has been a big advocate, and so has CDA. So that's a great point. There's a comment here from one of our fellows. Dr. Buell says, not all SSB are sweet. This is the biggest loophole that is being exploited. As a dentist in private practice, this is the biggest problem I see. Most people see personal responsibility to believe in misleading advertisements and exploits the underserved population who mainly rely on Google as their healthcare provider. Any comments on that?
Let's see, I'm trying to get what the question is. Exactly.
More of a comment in terms of
Okay.
how folks might go to Google to get their information as opposed to following evidence-based information that's out there.
Okay. And then there's the not all SSBs are sweet. Okay, well, I think misleading advertising, misinformation, industry exploiting vulnerable populations is a major problem. Which is where I think, the dental community and medical community can come in and be more vocal and more active in presenting evidence-based information. But we all have to agree on it first to be promoting a similar message. But, I think that industry influence is a major problem, and it's something that goes along with all of this. There have been efforts in the past to try to limit what industry can do with advertising, whether it be on TV or whether it be on social media. And there is no real effective regulation of this going on right now. The FTC back in the 1970s was basically prevented from taking any meaningful action. And basically now it's up to industry to volunteer to not target children and other vulnerable populations, but that's purely voluntary. And of course they don't follow through. So it's a real, misinformation is a real problem. I agree.
And another question says, what are your thoughts on partnership with medical providers? So I'm assuming it's partnership between medical and dental providers.
Yes, I think that's incredibly important. Oral health is often not thought about on the medical side. And I think we saw that in that article where the Berkeley Media Studies Group was examining the health arguments for soda taxes, where oral health sort of gets forgotten about a lot of times. But as more audiences on the medical side begin to understand the evidence linking sugar to dental caries and the support that can give for these types of policies, that's one way that the medical side has gotten more interested in collaborating with the dental side. But I think there's been some real encouraging partnerships between the California Dental Association and the California Medical Association in our state. I think it's great opportunities to work together to have more of an effect.
Thank you. How should oral health messaging regarding artificial sweeteners be framed?
Yeah, that actually came up. I did a presentation with Carrie Gordon from the CDA and Jared Fine from Alameda County at the SOTA Summit that the Center for Science and the Public Interest put on, and that came up, artificial sweeteners. And that's sort of tough because artificial sweeteners in sodas, we know as dentists that even a diet soda can be harmful to teeth because of the acid and the tooth erosion that can occur. So we don't really want to be promoting artificially sweetened sodas. The other thing that's happening is with so much attention on reducing added sugars that we're seeing the consumption of artificial sweeteners go up, and the labeling of artificial sweeteners is not very forthcoming. So it's getting harder to understand how much artificial sweetener is going into various products. And this becomes a particular concern for children who might be approaching safety thresholds for artificial sweeteners. So it's definitely an issue that needs to be examined closely.
Those are great points. Do you see much differences in beliefs between urban and rural areas when it comes to sugar and oral health?
Our sample size wasn't really big enough, I don't think, for us to see any effect in what we were looking at. But my plan is actually to do a much larger survey. So this was really just preliminary data for me, and I was able to use this as part of a grant application. So I intend to do a national survey with a much larger sample size that will hopefully give us more information on things like urban versus rural. But I would expect that there are differences.
That's great. Good luck on that national survey. We look forward to seeing the results from that. There's another question, and perhaps if Dr. Kumar is here, maybe he could answer that one. Is there any way we can participate with CDPH, the California Department of Public Health, to voice our concerns regarding SSB outside of the CDA? You can share your thoughts, Dr. Kearns, but I don't know if Dr. Kumar is on here too. I think he is. Saw him earlier, so maybe he can take it.
Okay. I'll let Dr. Kumar answer if he's there.
Can you repeat the question?
Sure, Dr. Kumar. Is there any way we can participate, and I'm assuming Champion Provider Fellows can participate with the California Department of Public Health to voice our concerns regarding SSB outside of the California Dental Association? Thank you.
Voicing concern is not going to help us to move the agenda forward. So I would say you have to come up with some plan of action to improve oral health. And, look at tobacco as an example and see what lessons can be learned through that one. We just published, I put it in the chat box, a brief. We worked with the NEOP program here. It's a project with Harvard. It's a micro simulation model. It's about the impact of SSB tax on obesity and tooth decay. So we would like to hear not only concerns, but some solutions to those concerns.
Thank you, Dr. Kumar. I think that is helpful, and absolutely. I think on a local level too, we have been partnering with NEOP, sort of trying to work on issues that we can address through both these programs, the local oral health programs, as well as the NEOP program within the public health departments. So that's a great point. I have a question, Dr. Kearns, and I was wondering if you might be able to address, you talked about in your second paper, the beliefs and the attitudes. And I wonder if you could address how those correlate, because on the one hand, we're seeing that when you're asking about the beliefs, the dentists do think it's their responsibility, to talk about reducing sugar intake in their patients' diets. But then when it comes to the attitudes, you see a whole different picture there, and there's not as much as support as you would like to see. So do you want to address that? And then a follow-up question would be, what would your recommendations be out of the paper that you discussed earlier with us?
Sure. Yes. So what I think what our data was telling us is that dentists really do believe that sugar is an important factor in causing dental caries. You know, they think it's something within their practice that they should be discussing with their patients. But it seemed like most dentists, when it comes to actually taking policy action, so implementing a soda tax or a warning label, they are less sure that that type of action is actually going to influence dental caries outcomes. And one of those reasons is because they don't think people are going to change their behavior. They don't think it's realistic that people will change. Another reason is they think maybe that a soda tax isn't actually effective, and maybe it's that, you know, sugars come from all different sources. There's high sugary foods out there as well, and you know, if you don't impact all sugary foods, then you're not going to make as much of a difference on dental caries otherwise. So that's kind of how I read that. To change those attitudes, I think that's where, you know, what's going on in California, coming together with Jay, with the CDA, with others, and really, and particularly the link that Dr. Kumar just shared, where there's evidence supporting policy action that's being promoted by dental leaders, getting that out to dental professionals all over California, I think would be really important in changing some of those attitudes and beliefs that would hopefully lead dentists to consider getting more engaged in supporting these policies.
Thank you. That was very helpful. And I don't see any other questions in the chat box, so I might ask another one, if that's okay. It was very interesting to see how WHO's policies and recommendations are affected by the global funding situation, and who funds them, and how at certain times they might, you know, redact on certain things that they want to talk about or be afraid to say something. So how can champion fellows navigate issues like that? And we're not just talking about WHO, but this happens locally as well. Any thoughts around that?
Well, I think, you know, awareness is sort of one of the first steps, you know, being aware that there is an active industry out there always seeking to shape these debates. They don't stop. They constantly have hired public relations organizations who are scanning the media, they're scanning the legislative docket, they're scanning the scientific evidence for any sign, you know, that California is going to get active again on policy action. They know it's coming, you know, they attend our conferences. So we have to be aware that that's happening. You know, that is a thing that goes on all the time. And we need to be prepared to come out as strong to oppose what the industry is doing on our side. So we need to be working together, be speaking with one voice, you know, be presenting the same evidence. That's what I would say and recommend.
There's another question from Dr. Kumar. Are there lessons to be learned from how California addressed tobacco by developing policies? Are there similarities between sugar and tobacco industry approaches?
I would say definitely, absolutely. And, you know, the tobacco story is a very long story. You can't really point to any one particular thing. California has been very proactive in tobacco control. There are a lot of lessons from California in particular. You know, of course, my area truly is sort of looking at the industry side, and this has been something that's been very important to the tobacco control successes. So being able to show that the tobacco industry was casting doubt on the evidence, you know, that they were opposing legislation, getting that message out to the public, getting that message out to policymakers really shifted people's attitudes towards the tobacco companies and kind of laid the groundwork for being able to be successful in policy action. It wasn't the only thing, but it was one of the things. But looking to the tobacco industry definitely is a good thing to do. I was going to say one more thing and I just forgot what it was. Maybe it'll come to me here in a second. But yeah, the tobacco example is a very good example.
We have a few more minutes left, so I think we can take a couple more questions. There is one question about preemption, and if you have any thoughts around that, if there's any advocacy going around reversing the preemption that happened a few years ago. And then the other question is about whether you think campaigns like Rethink Your Drink could help in changing policy.
Yeah, so the preemption example in California is pretty unbelievable. And do most people know about that, or do I need to describe it?
I think it might be helpful to talk about it, Dr. Kearns.
Okay.
Not all of us might be aware of it.
Sure. So, so California, cities in California have been very proactive in implementing soda taxes, Berkeley, San Francisco, et cetera. And as the American Beverage Association saw this happening, you know, they were dumping millions of dollars to oppose each one of these city-based efforts as they were popping up. So what they wanted to do was to implement something at the state level that would ban any new soda tax in any municipality in California. This is called preemption. So the state preempts any action at the local level. So they used a very creative strategy to do this. So the American Beverage Association supported a new legislative initiative that would have required a 2/3 majority vote to support any new tax measure in the state. That's any new tax measure, not just soda. Nobody wanted that to pass. That raising the threshold to get a tax pass would have affected many, many stakeholder communities. So they were able to negotiate a deal with labor actually to align with the beverage industry to kind of threaten the legislature and say, if you don't want us to push this 2/3 majority initiative forward, then implement a moratorium, a ban on soda taxes for the next 12 years. And that's what happened. We got a ban on soda taxes for a 12-year period, which is just incredible that they were able to do that. And there have been efforts to overturn that. So I know, you know, the California Dental Association is right back in that fight, trying to strategize ways to get that overturned. I think there was an attempt this legislative session that fizzled out. And I think that they will pick it up again the next chance that they have. But I think this is going to be a continued fight.
Thank you. I think we are up on our time and we want to be respectful of everybody's time. So I'm going to pass it on to Alana to close today's session. Thank you again, Dr. Kearns.
Thank you.
Yeah, thank you so much for this fabulous presentation. I think a lot of the work that we strive to do within the Champion Provider Fellowship Program, kind of talking about messaging, talking about how both physicians and dentists can be more effective communicators. And I think a lot of what you presented today will be really interesting food for thought as we move forward and thinking about how we can address some of these messagings to really, and also how we can kind of engage our spheres of influence to really kind of turn the tide in some meaningful ways. So I really want to thank you, Dr. Kearns, Dr. Pendekar as well for moderating today's session, as well as all of the Champion Provider Fellows and local health department representatives that were on today's call, including Dr. Kumar. I appreciate you being able to join us for today. This presentation was recorded, so we will be posting it up on our website by Tuesday of next week, and we will also be sending a link out with the recording. So feel free, if there's any other follow-up questions, you can always reach out to us, and I hope everybody has a wonderful rest of their day.
Great, thank you so much.
Bye.
Bye-bye.
Thank you. Bye, everyone.